Daft as a brush ambulances take cancer patients to and from their hospital treatment for free. It was started by Brian Burnie in Newcastle 6 years ago with one ambulance. Now there are 26, providing 30,000 patient journeys a year, and Brian wants to expand the service.
The worst part about having cancer treatment isn't the actual treatment in the hospital, it's getting to and from hospital. My ambition is to provide 1 million cancer patient journeys in Great Britain and Ireland, free of charge.
The hospital know that we do what we say we're going to do, that we will have the patients where they're supposed to be, just ahead of time, ready and happy for treatment.
The stress and anxiety that a patient goes through, worrying how they're going to get to and from hospital, is immense. If we can take that stress and anxiety down, it makes the radiographer's job that much easier.
If they're less stressed, they are more relaxed when it comes to delivery of the treatment, which allows us to position the patients and hopefully deliver really accurate treatment.
It helps us to get the patients in on time, which obviously means that we can deliver the treatment and the chemotherapy in an efficient and effective way. Without it, we would struggle to meet the demands of the service each day, so we wouldn't be able to get as many patients in.
Patients' compliance with their course of treatment is improved. In the past, some patients, unfortunately, despite everyone's best efforts, have decided not to complete their course of radiotherapy or chemotherapy because of the difficulties of having to travel into the cancer centre.
The actual volunteers themselves have got a good knowledge of the department because we do tours with them, we work very closely with them, so they know what the patient journey entails, so they can answer questions and put the patients at ease really.
Sometimes they're a little bit nervous, they want somebody with them, so we'll stay with them until they go in for the treatment if that's what they want.
Oh, it's a godsend, because before that we were having to get taxis back and forwards.
Well, it meant us getting 2, possibly 3 buses to get into here for treatment and then the same to go back again.
It's taking the stress out of the drive, not having to rely on family or friends, you know, so you're just less stressful than it could have really been, I suppose.
Daft as a brush was introduced here some years ago and works really seamlessly. It seems to coordinate very well with the North East Ambulance Service, who are also obviously important in transporting patients around the region and to this trust.
Daft as a brush has been perfected over 6 years. Now they can support you in setting up a similar service for your cancer centre.
We'll be giving them a starter pack, so when they do start, they have everything at their fingertips. We'll show them how we do it in the northeast of England. That's everything from fundraising to recruitment of staff to working with the hospital, but more importantly, how we improve the life of cancer patients.
I've been doing this job for around about 5 years now, and I honestly don't know how we managed the unit without Daft as a brush's support. It just makes everything much smoother. It's better for the patients, it's better for the staff, it's better for the run of the unit. I would have absolutely no hesitation in recommending the service to other units because it's a fantastic service.
I honestly couldn't imagine how we would now function as a cancer centre without Daft as a brush. They've made such a significant difference.
We've tried and tested it, and I think it's a model that's very transferable to other centres and would highly, highly recommend it.
For more information, contact Daft as a brush in Newcastle.